So next, let's review some of the risks associated with these surgeries. It would be completely inappropriate for me to tell you how great each of these surgeries are if I didn't also tell you about the risk. So let's start with a gastric bypass. Bleeding and infection are both risks that can certainly happen after gastric bypass or any other surgery. It is our job to control those at the time of your surgery. We give you an antibiotic before you even have surgery to help reduce your infection rate. With the use of small incisions, this also helps reduce that infection rate to less than 0.5%. Bleeding is a complication that can occur after gastric bypass, but it's exceedingly rare. Very few patients will need a blood transfusion, and certainly even rarer patients will need a return to the operating room. Leaks occurring at the connections that are made during a gastric bypass are exceedingly rare, and we perform checks at the time of your surgery to ensure that you do not have any. Blood clots are at risk for any of our bariatric patients, not just the gastric bypass. Morbid obesity puts a patient at an increased risk for the development of blood clots. We are very aggressive in the treatment and prevention of those blood clots. You will be given a blood thinner the day of surgery and for every day that you're in the hospital. For patients with a BMI over 50, they will go home with a blood thinner for an additional 30 days. Ulcer formation is a rare but very important risk factor to discuss when talking about gastric bypass. The acid that's normally produced in the stomach is still produced in that little pouch, and the small bowel that it's now connected to has built up its defenses to prevent the formation of ulcers. There are two things in particular that can break down those defenses. The first one is smoking. Smoking is not advised for any gastric bypass patient. The other risk factor for the development of ulcers is the use of NSAIDs. NSAIDs includes medications such as Advil, Aleve, ibuprofen, and Motrin. Ulcers can go on to cause life-threatening bleeding, holes within the bowel, and chronic pain. It is really important to avoid smoking and NSAIDs to prevent the formation of ulcers. Hernias are another risk factor associated with gastric bypass, but we're not talking about abdominal wall hernias like belly button hernias, we're talking about internal hernias. When we connect that small bowel up to the gastric pouch, there are two areas that can be created that allows bowel to twist into and get stuck. The good thing is that we know where those two areas are, and we close them down with permanent suture at the time of your surgery. Pain, nausea, and vomiting are additional risk factors associated with the gastric bypass, but I will tell you that pain is very minimal as we use very small incisions for your surgery, and the majority of my patients go home the next day from surgery without any narcotics on board, simply taking Tylenol and using a heating pad. In the first 24 hours following gastric bypass surgery, patients can experience nausea. Oftentimes, this is associated with anesthesia, and once that's out of the system within that 24 hours, patients are tolerating their liquid diet and are able to go home the day after surgery. Patients will not be discharged home until they are able to tolerate that liquid diet. Dumping syndrome is a risk factor specifically associated with the gastric bypass. When a patient eats something that's particularly sugary, the small bowel is not sure how to handle it. So what it does is that it brings fluid from your blood vessels and tries to dilute it within the lumen of the bowel. This drops your blood pressure. Patients tend to get very sweaty during this period. And then the second part of dumping syndrome occurs, where patients are running off to the bathroom with diarrhea with all that fluid now sitting in their bowel. Not all patients have dumping syndrome, but those that do can prevent the symptoms by avoiding high sugar foods. Patients often worry about hair loss and lack of vitamins following gastric bypass. Patients will naturally have some hair loss approximately 2 to 3 months following any major surgery, not specific to bariatric surgery. In order to regain that hair loss, patients need to focus on protein as their primary fuel source. This is part of the education that patients will receive prior to surgery. Patients who have undergone bariatric surgery will follow up with their bariatric team on at least a yearly basis in order to have their vitamin levels checked. Let's move on to the sleeve gastrectomy. Some of the risk factors are going to be the same as the gastric bypass, such as bleeding, infection, blood clots, ulcers, pain, nausea, and vomiting, and hair loss. Let's talk specifically about leaks. Leaks can happen with the sleeve gastrectomy at a slightly higher rate than the gastric bypass, at around 1%. We at Christiana Care have the unique opportunity to provide advanced techniques for any patients that have suffered from a leak. This typically does not require a return to the operating room, and patients heal within several weeks and can go on without any further complications. Reflux disease is one of the more common complications related to sleeve gastrectomy. What we have found is that the sleeve gastrectomy is a high-pressure system. And so for patients that struggle with reflux before surgery, the sleeve gastrectomy can actually make that reflux worse. For any patient that's struggling with daily medications to treat their reflux and still having symptoms, the sleeve gastrectomy may not be the surgery for you. Thankfully, we have another surgery that can help treat reflux, and that's the gastric bypass. Following sleeve gastrectomy, patients are often very concerned that they will stretch out their sleeve. It's a really difficult thing to do. Patients need to overeat consistently every day for weeks and months in order for that to happen. If you take care of your sleeve, maintain small meals throughout the day, this is a very rare occurrence. We now know that the adjustable gastric band is associated with a high risk of complications, including a 20% risk of a patient needing additional surgery within 5 years of its placement. It is for these reasons that Christiana Care does not offer the gastric band for our patients.